Why did I become a doctor? I must say this is a calling. I thought about pursuing another career, but everything led me back to medicine. The vision was to become the doctor who treated people like family, addressed their concerns, and answered their questions. The challenges I faced pertain to being underestimated and marginalized, but I remained committed, determined, and persevered through the adversity. It was tough, but it was also motivating. I cannot forget how my faith and my family gave me inspiration and strength. I should begin by saying social determinants of health are not new. My simple definition is that these are factors and/or conditions which impact the health, well-being, and the long-term health outcomes of individuals and segments of our society. But the recognition has facilitated the development of more resources to help address some of these concerns. I am aware and have been aware of these inequities. I can also state that Dr. Appiah was also aware of the needs of underserved populations when he created a transportation service, crafted a medication assistance program, and planned senior centers which house a variety of community resources.
Vaccinations were introduced in this country through an enslaved African man named Onesimus. Onesimus taught his master the early techniques of inoculations that he had learned in Africa. And this was instrumental in Boston, where he lived at the time, because in the early 1700s, smallpox found its way to Boston. So they utilized these inoculation techniques and saved hundreds and thousands of lives. Vaccinations are instrumental in the public's health. Vaccinations have helped to eradicate diseases like smallpox and polio. They've also helped to decrease the negative sequelae of diseases like COVID-19. It is essential that every person, every American, get the necessary vaccines to stay healthy.
Increasing diversity among healthcare professionals is important for a variety of reasons. I believe most people are now aware of the immoral and inhumane actions Black Americans suffered for the advancement of medicine. This history is the recent past for some and is the root of deep mistrust. It has been shown Black patients have better outcomes with Black healthcare providers, and patients in general do better with providers from similar backgrounds. That does not mean we need to segregate patients and healthcare providers. It means we, as medical professionals, need to develop a better understanding and appreciation of those from different backgrounds, ethnically, racially, and economically. Or in other words, develop cultural competency.
Diversity amongst healthcare professionals is very important. It's important for a myriad of reasons, particularly in the Black community. History has taught us to be somewhat distrusting of the medical community. Case in point, the Tuskegee Experiment. Personally, I had a hard time getting my own grandfather to get a flu vaccination because he was convinced that something was going to happen to him. Many of my patients say they come and they trust what we say, what I say, because we share a cultural connection.
I think it is important to learn the full history, and Black History Month provides an opportunity to focus on those who have been traditionally omitted from the history books. We must also continue to expand upon the individuals who have made invaluable contributions to this country, including medicine and technology.
Black history is American history.